If you are over 50 years old, and you have been noticing small changes in your body that you keep ignoring, this video could be one of the most important things you watch this year. Because what I am about to share with you is something that millions of people over 50 discover too late. Your kidneys, two fist-sized organs sitting quietly in your lower back, are responsible for filtering over 200 liters of blood every single day. And here is the frightening truth. Kidney disease has no pain in the early stages. No obvious warning. No laudalarm. It silently damages your body for years, before most people even realize something is wrong. But your body does send signals. Small, easy to miss, often mistaken for something else. And in this video, I am going to walk you through every single one of them. Stay with me until the end, because the last sign I share is the one most people completely overlook. Credibility bridge. Before we begin, I want to be very clear. This video is for educational purposes. It is based on medical research, clinical studies, and expert recommendations from kidney health specialists. If you recognize any of these signs in yourself or someone you love, please consult your doctor immediately. Early detection of kidney disease can make an enormous difference. In many cases, it can completely stop the progression, but only if you catch it in time. Now let us begin. Sign 1. Changes in urination. The very first sign your kidneys may be struggling is a change in your urination habits. Now I know this is not a comfortable topic, but it is one of the most important signals your body can give you. So pay close attention. If you are waking up multiple times at night to urinate, if your urine appears foamy or bubbly, if you notice blood in your urine, or if you are urinating far less than usual despite drinking water, these are not normal signs of aging. Foamy urine in particular is a red flag. It means protein is leaking into your urine. And protein in urine, medically called proteinuria, is one of the earliest and most reliable signs of kidney damage. Healthy kidneys filter waste but keep protein in your blood. When they are damaged, that barrier breaks down, and protein escapes into places it should never be. If you have noticed foamy urine more than twice in the past month, do not wait. Get a urine test done. It takes 5 minutes, and it could save your life. Sign 2. Swelling in the legs, ankles, and feet. The second sign is one that most people blame on standing too long or getting older. Swelling, specifically in the legs, ankles, and feet. When your kidneys are not functioning properly, they lose the ability to remove excess sodium from your body. And when sodium builds up, your body retains water. That water collects in your lower body, causing that familiar puffiness around your ankles and feet. Now here is how to tell the difference between normal swelling and kidney-related swelling. Press your finger firmly into the swollen area for 5 seconds. Then release. If the indentation remains for several seconds, that is called pitting edema, and it is a clinical sign that your kidneys may not be managing fluid correctly. This is not something to sleep on, especially after the age of 50. Sign 3. Extreme fatigue and brain fog. Do you feel tired all the time? Not just sleepy, but deeply exhausted. The kind of fatigue that does not go away even after a full night of sleep. When kidneys are failing, they produce less of a hormone called erythropoietin. This hormone signals your bone marrow to produce red blood cells. Fewer red blood cells means less oxygen reaching your muscles and brain. The result: crushing fatigue, difficulty concentrating, mental fog that makes even simple tasks feel overwhelming. Many people over 50 blame this on stress, age, or poor sleep. And sometimes it is. But when fatigue comes with other signs on this list, it becomes a serious pattern that your doctor needs to know about. Sign 4. Persistent back pain below the ribs. Many people confuse kidney pain with back pain. And understandably so, because the kidneys sit just below your rib cage on both sides of your spine. But kidney pain has a specific character. It is a deep, dull ache. It does not improve with stretching or movement. It is located in the flank area, meaning the sides of your lower back, not the center. and it is sometimes accompanied by nausea or fever. This type of pain can indicate kidney stones, kidney infection, or in more serious cases, the early stages of kidney disease. If you have been experiencing this kind of persistent back discomfort, and you are over 50, please do not dismiss it as a simple muscle issue. Sign 5. Skin problems and persistent itching. This next sign surprises most people, because very few associate their skin with their kidneys. When kidney function declines, waste products that should be filtered out of the blood begin to accumulate. This buildup of toxins affects the skin in two major ways. First, persistent itching, especially at night, not caused by dry skin or allergies, but by waste products that have nowhere to go. Second, a dull, grayish or yellowish tone to the skin. If you have been scratching at night with no clear cause, or if people have mentioned that your skin looks dull or discolored lately, please bring this up with your doctor. It is not a cosmetic issue. It is a metabolic one. Sign 6. Nausea, vomiting and loss of appetite. As kidney function drops, a condition called uremia can develop. Uremia means that urea, a waste product normally removed by the kidneys, begins building up in the blood, and the effects on your digestive system are significant. Persistent nausea, occasional vomiting without a clear cause, a complete loss of appetite. Some people describe a metallic taste in their mouth, or a constant feeling that food just does not taste right anymore. If you have been experiencing unexplained nausea regularly, especially combined with fatigue and swelling, your kidneys may be struggling to keep up with their filtering workload. Sign 7. Shortness of breath. Shortness of breath is not something most people connect to kidneys. They think heart, they think lungs. But kidney failure can directly cause breathing difficulties in two ways. First, fluid buildup. When kidneys cannot remove excess fluid, it can accumulate in the lungs, making it difficult to breathe, especially when lying down. Second, anemia. As we discussed earlier, failing kidneys produce less erythropoietin. Less red blood cells means less oxygen in the blood, and your body responds by making you breathe harder to compensate. If you find yourself becoming breathless after minimal activity, or waking up at night struggling to breathe, this requires immediate medical attention. Sign 8. High blood pressure that is hard to control. Here is something that surprises many people. High blood pressure and kidney disease feed each other. Damaged kidneys cannot regulate blood pressure properly, and high blood pressure, in return, damages the kidneys further. It is a dangerous cycle. If you are already on blood pressure medication, but your numbers remain difficult to control, your doctor should check your kidney function, because in many cases, uncontrolled hypertension after 50 is a hidden signal of declining kidney health. Sign 9. Muscle cramps and weakness. Electrolyte imbalances are a hallmark of poor kidney function. The kidneys regulate key minerals in your body: sodium, potassium, calcium, and phosphorus. When these levels go out of balance, your muscles suffer. Painful leg cramps, especially at night. General muscle weakness throughout the day. Difficulty gripping objects or climbing stairs. Many people over 50 experience leg cramps and think nothing of it. But when cramps are frequent, severe, and not explained by dehydration or exercise, they deserve closer attention. Sign 10, the one most people completely miss. Now, I promised you the sign that most people completely overlook. And here it is. Changes in the color of your urine. Not just blood, which most people know to watch for, but the specific shades of yellow, orange, brown, or even dark tea color. Dark brown or cola-colored urine is a serious warning sign. It can mean that red blood cells are breaking down inside the kidneys, or that kidney damage has progressed to a point where blood is mixing into the urine in small amounts not visible to the naked eye. And here is why this sign gets missed. Many people check their urine in a dim bathroom, or they rush and do not look at all, or they drink strong tea or coffee and assume it caused the color change. Starting today, pay attention to your urine color every single morning. Normal healthy urine is pale yellow. Anything darker than light yellow, consistently, deserves medical evaluation. This one habit could be the difference between catching kidney disease early and finding out when it is already serious. Risk factors after 50. Now that you know the signs, let me tell you who is most at risk after the age of 50. Number 1. People with diabetes. High blood sugar over time destroys the tiny blood vessels in the kidneys. Diabetic nephropathy is the leading cause of kidney failure worldwide. Number 2. People with high blood pressure. As we discussed, these two conditions are deeply connected. Number 3. People who take frequent pain medication. NSAIDs like ibuprofen and naproxen, taken regularly, can silently damage kidney tissue over years. Number 4. People who are overweight. Excess weight puts extra pressure on the kidneys and increases the risk of both diabetes and hypertension. Number 5. People with a family history of kidney disease. Genetics play a real role. If a parent or sibling has had kidney problems, your risk is significantly higher. If you fall into any of these categories, and you recognize even 2 or 3 signs from this video, please do not delay getting tested. What to do right now? Here is the good news. Kidney disease caught early is manageable. In many cases, with the right lifestyle changes and medical support, its progression can be significantly slowed or even stopped. So here is what I want you to do after watching this video. Step 1. Book a blood test. Ask your doctor specifically for a creatinine test and GFR, glomerular filtration rate. This tells you exactly how well your kidneys are filtering your blood. Step 2. Ask for a urine test. Specifically a urine albumin test. This checks for protein in your urine, one of the earliest signs of kidney damage. Step 3. Review your medications. Talk to your doctor about any pain medications or supplements you take regularly. Some common ones are harder on kidneys than people realize. Step 4. Drink more water. Adequate hydration is one of the simplest and most effective ways to support kidney health. Aim for 6 to 8 glasses of clean water daily. Step 5. Reduce sodium intake. Excess salt forces the kidneys to work harder. Cutting back protects them significantly. These 5 steps cost nothing, but they could protect something priceless. Your kidneys work every single minute of every single day. Filtering, balancing, protecting, and they ask very little in return. After 50, your body starts communicating differently. The signals become quieter, easier to explain away, easier to ignore. But the cost of ignoring them can be devastating. You watched this video for a reason. Maybe something in your body has been telling you to pay attention. Listen to it. Share this video with someone you love who is over 50. A parent, a sibling, a friend. Because the information in this video could genuinely change or save their life. Take care of your kidneys, and they will take care of you.